Hello and welcome to today's video. If you're watching this, you or someone you love may be facing the difficult journey of infertility. And I want to start by saying that I understand how overwhelming this process can feel. And you're not alone. In this video, we'll explore the causes of infertility, some of the tests that can help, and both conventional and herbal treatments, all while focusing on the emotional impact and what can be done to support you and your body and your partner's body through this process. So infertility is defined as not having conceived after a year of trying, though for women over 35, evaluations might begin a little bit sooner. Infertility is a deeply personal journey, and it's important to remember that most pregnancies happen within the first 3 weeks of trying. However, as we age, fertility decreases. For women, fertility begins to decline after age 30, and for most, the ability to conceive naturally is significantly reduced in their 40s. Male fertility also declines with age, with the optimal window being between 16 to 40 years of age. Now, I know hearing these numbers can be tough, but it's important to approach them with an open mind and an open heart. Fertility is complex and many factors come into play. Now, for women, infertility can result from a variety of conditions. 9% of women are affected presenting with PCOS, polycystic ovary syndrome, but there's also issues like tubal blocks, fibroids, infections, and thyroid dysfunction. And sometimes the immune system can also play a role, especially if there is recurrent miscarriages or an intolerance to semen, which is not really fully understood. There's also conditions like endometriosis or fibroids, which can be associated with both infertility and miscarriage. But these aren't always linked to the severity of the condition. Even something as small as an abnormal cervical mucus or cervical stenosis can inhibit conception. Now, causes of fertility in men. So on the men's side, sperm disorders account for about 30 to 45% of fertility issues in couples. Now, this could be due to DNA integrity or sperm motility or sperm count, which can be affected by lifestyle factors such as age, smoking, alcohol consumption, sauna use, hot tub use. Testing is important to understand what the root cause is, both for women and men. So in women, hormone tests such as FSH, LH, progesterone, and estradiol, which need to be done at specific points of your menstrual cycle to know exactly what's going on. And then there might be hysteralpingographies, laparoscopies, or hysteroscopies to examine the health of the reproductive organs. Now, for men, sperm analysis is the key part of understanding fertility. One simple and effective way to track your fertility is by understanding your ovulation cycle. And this is typically about 14 days after menstruation begins. But it varies from woman to woman. There's tools that are useful, and there's a lot of phone apps that can help with this. But basal body temperature, which observes your temperature on any given day, and observing the cervical fluid changes can help you determine when ovulation is happening. So cervical fluid should have a stretchy, egg white-like consistency on the days leading up to ovulation. This is the time whenever the sperm is most likely to survive and to fertilize the egg. And understanding those subtle changes can be really quite empowering. If you've experienced recurrent miscarriages, I just want to take a moment and acknowledge how devastating and heartbreaking that can be. Miscarriages often happen on a first pregnancy for people, and later on it can be associated with chromosomal abnormalities within the baby or the fetus, hormonal imbalances, or immune issues. They can also happen due to factors such as age, structural issues, or nutrient deficiencies. Now, most miscarriages occur after implantation, and they sometimes seem like a little bit of a late period. And it's important to take time to heal emotionally and physically during this time. Now, there's a number of factors that can impact your fertility. These include alcohol consumption, which increases the risk of miscarriage, especially during conception. Caffeine, which can impair estrogen production. And then there's things such as thyroid dysfunction, which affects hormone regulation, and environmental toxins like pesticides or air pollutants. And of course, stress. So stress can have a significant impact on your hormonal imbalance. And smoking is also a key factor in both male and female fertility, reducing overall fertility and increasing the risks of miscarriage and stillbirth. Now, there are conventional treatments available. Some of the drugs that you might be given from a doctor are clomiphene, which is an anti-estrogen that helps stimulate ovulation, letrozole, which is an aromatase inhibitor that reduces estrogen, and gonadotropins, which help with ovulation but do carry risks like ovarian hyperstimulation syndrome. Now, for some couples, IVF may be the chosen path, and it's important to prepare your body for IVF with diet, herbs, and nutrition for about 3 to 4 months before conception. And that's because it takes 3 to 4 months for the sperm to go from being created into full maturity. Now, herbal treatment aims. Herbs play a powerful role in supporting both male and female fertility. And herbal treatments aim to improve sperm health, balance your hormone levels, and regulate ovarian function, supporting uterine lining, making it receptive for implantation, and reducing stress, which is critical for our hormonal balance. Key herbs are herbs such as Vitex agnus castus. This is known commonly as chasteberry to support hormone modulation. Peony Dioscorea villosa, this is wild yam, or Tribulus terrestris are phytosterols. They work as a steroid or hormone within the ovaries and support ovarian function. Ashwagandha and rhodiola to help reduce stress and support thyroid function. Now, it's essential to begin preparing your body from conception 3 to 4 months before trying, and this includes quitting smoking, reducing alcohol, and embracing a Mediterranean-style diet rich in vegetables, fruit, fish, and healthy fats. Healthy weight management is also important, as is being either underweight and overweight can impact your fertility. Exercise is beneficial, but it's important not to overdo it. So gentle, moderate activity to help balance hormones and reduce stress. Many people will ask what vitamins or supplements that we would recommend. CoQ10 can help improve egg quality and embryo development. Folic acid and B12 are essential for preventing birth defects and increasing live birth rates. Magnesium and zinc support overall reproductive health in both male and females. And then the probiotics, especially lactobacillus, to help improve the vaginal gut and microbiome. Now, infertility can be an incredibly emotional journey, and I want to remind you that you're not alone. Whether you're seeking conventional treatments or natural support or a combination of both, it's important to approach that process with patience and with kindness towards yourself. Take time to nurture your body and your mind as you work towards your goal of growing a family. And take time. Quite often, people, when they've given up and feel that there's nothing else they can do to have a baby, it's at the point of giving up and giving it away that they find out they're pregnant, or they have pursued fostering or adoption, and as soon as a placement has landed, they find out that they're pregnant. So there is hope out there. And I certainly am not one to try and get in the way of the hands of God. Now, thank you for watching. I hope you find this video helpful. And if you did, do please like and subscribe it and share it with anybody else who may be in a similar journey. And sending you all the best for your path into parenthood.